So thank you all for joining us today for Congresswoman Sherrill's webinar on VA benefits and healthcare. This is the latest in our series of informational webinars with guests from federal agencies. She apologizes that she was unable to join us in person today, but we have a great program planned and I want to get right into it. My name is Willie Tolba. I work in the Congresswoman's Livingston office and I'll be the host for this program. So here in the district office, we hear all the time from constituents who are veterans or their family members or friends of veterans. The VA provides a lot of resources, including disability benefits, educational benefits, healthcare benefits, employment-related benefits, and more. You might have some questions on how to even get started. I'm so glad that we have these fantastic panelists today. They're going to be able to give you an overview of some of the programs that are available to you. So I just want to cover a few things before we begin. If you have a question, please use the chat box on your screen or the Q&A function. Our staff is going to be reviewing the Q&A portion during that part of the event. Please keep in mind that this webinar is being recorded, so please refrain from disclosing any personal information with your questions. We'll get to as many questions as time allows. If we're unable to get to your question, feel free to follow up with our office and we'll handle it then. And then we're happy to share copies of the slides you'll see today, along with some helpful resources provided by the agency. The webinar is being recorded and will be posted to our YouTube channel. And with that, I'm going to turn it over to our panelists. Joining us today are Robert and Shania from the VA Newark Regional Office. After that, we'll hear from Scott from the VA New Jersey Healthcare System. So we have a lot to cover, so let's go ahead and get started. All right, Robert, all you.
Hey, Willie, thank you very much. And good morning, everyone. My name is Robert Bost, and I am a management analyst and public affairs officer at the Newark Regional Office, Department of Veterans Affairs. Before I begin, let me just make sure, can everyone see my screen? I just started sharing screen, so I want to make sure.
I can see it, yes.
Yeah, we're good. And it's full screen? Great. Okay, so odds are if you're attending this call, you have either applied for VA benefits or you're looking to learn more about how to do so. And so that is our goal today, right? To provide as much information as we can on the general VA process, whether you're a veteran, a claimant, or a family member. On this screen, you can see my direct contact information, as well as the Newark Regional Office phone number, which I will share again shortly in the slides to come. So for those of you that don't already know, the Department of Veterans Affairs is made up of three major but exclusive functions. The Veterans Health Administration, our colleague Scott will be speaking on VHA in a little bit. The Veterans Benefits Administration, which is the function that my colleague Shania and I work for, and the National Cemetery Administration for processing burial requests in national cemeteries, Arlington, et cetera. In short, if you're seeking VA healthcare or immediate healthcare services, you would contact the Veterans Health Administration, which actually I put the direct phone line for at the bottom left of the screen. If you're looking for anything for burial information, for planning, or cemetery information, you would contact NCA, the bottom right side of the screen. And finally, if you're seeking information on VA benefits, monthly disability compensation, VA pension, et cetera, you would contact the benefits hotline number, which is right there at the bottom middle of this screen. And we will be sharing these slides as PDFs at the end of today's presentation for everyone's awareness. That way you can save this information for yourself. And as always, we always recommend reaching out to va.gov directly for all the information that you need, whether it's healthcare benefits or cemetery information. So where I work, the Veterans Benefits Administration, we process claims for disability compensation. There are 58 different regional offices all throughout the country, some of which actually have centralized functions and others with more capabilities. But for the most part, regional offices work on claims for disability compensation, veterans pension, survivors benefits, and or education benefits like GI Bill, or veteran readiness and employment services to help assist in securing civilian employment. If you've ever incurred an injury while on active duty service, you may file a claim for VA monthly disability compensation. And the way this usually works is seen here on the screen. A claim is received either online or a mailed 526 easy form, right, which is a standardized form. The claim is then reviewed by a specific station. And again, it could be any of the 58 stations that we have throughout the country. Um, and evidence is gathered in support of your claim, then reviewed, and examiners make an assessment. And finally, a rater determines a rating based on the evidence and a decision rendered. Uh, we always recommend the fastest way to submit a claim and begin the process is directly at va.gov. Otherwise, you may submit a claim by mail. However, the one thing we recommend is working with a free and accredited veteran service officer or organization to submit a claim on your behalf. These are experienced professionals, and I'm also going to shortly share some direct contact information for VSOs. And you've heard of them: DAV, VFW, your county VSO. These are free and accredited organizations that can do this very thing for you. And at the bottom of the screen, too, you'll also see a direct link to just how to file a claim, general information, va.gov /disability / how to file a claim. So some more general benefits information, right? If you're unsure or not ready to submit a claim yourself, you may submit what is called an intent to file. And this form is very simple. It's just 2 pages. And submitting this form to VA initiates an effective date for your claim and allows 1 year for you to get a full claim submitted back to VA. So in a sense, it preserves an original effective date and potentially provides back pay to that date that you submitted, right, the intent to file originally, if you're granted favorably for your claim. If you don't want to utilize a VSO, it's no problem at all. You can go right to va.gov, right? And you can submit online directly to VA, or you can print out, again, I mentioned briefly before, what is called a VA Form 21/526EZ. And this is the general form that you would use to file a new claim, an initial claim for any number of contentions you may wish to file for. There are numerous spaces to put all different types of contentions on this form, and you can submit it directly to VA, to the intake center, and it's all on the form itself. It'll tell you where to mail it to and all that. Though remember, there are different forms for different types of claims. So this is another reason why we usually recommend to work with a VSO. For example, if you want to appeal, you wouldn't be submitting the 526, you would be submitting a supplemental form or a higher level review or a board appeal. You could get into a situation where you might not understand which form to utilize. Yes, you can always call the 1-800 number for the benefits line and ask which form to utilize, or you can go to va.gov. But again, this is where we recommend working with the VSO because they're really helpful in that regard. So if the last thing I want to mention here is if you're not a veteran, right, yourself, but you're trying to contact VA on behalf of a veteran, VA is only authorized to disclose information to a third party with a signed 0845. That's the authorization to disclose personal information to a third party. It's different, however, obviously, if the veteran's deceased and you're looking for personnel records to verify their service and all that. But for the most part, if you wish to inquire about a veteran or on behalf of a veteran, but you're not the veteran or claim it yourself, we need that authorization signed by the veteran or the claimant, and that's the form that we would provide there. So again, I had mentioned a couple times, but I can't stress enough, utilize a VSO if you incurred an injury during your active duty service and you've never sought out VA benefits before. These services are here for you to seek out and to submit claims for, but we do recommend utilizing a VSO. And I know Willie had mentioned that the 3 counties associated with a lot of the constituents on this call are Morris, Essex, and Passaic County. I have direct phone numbers I can provide Willie shortly for each of those counties that he can put into the chat. for your county VSOs, but also for Essex County, for example, we would direct you normally right to our Newark Regional Office anyway. And on the right side of the screen, you see American Legion. We have at our office, DAV, the State Department of Military and Veterans Affairs, VFW, Vietnam Veterans of America, etc. And on the left side of this screen, you can see the top left, we have the Newark RO front desk number, which is 973-297-3216. We have public contact reps that would be happy to assist if you have any kind of basic question or a claim status. But again, the VA hotline is right there to the left side, 1-800-827-1000. That's the VA benefits hotline. So with that, I want to pass it over to my colleague Shania to speak more about our VR&E services for everyone here. Thank you very much.
Good morning, everybody. As Robert said, my name is Shania Gartrell, and I'm a veteran. I work under Veteran Readiness and Employment Services in the Newark Regional Office. We cover the whole state of New Jersey, assisting service members and veterans with their education and employment services. To be eligible for our services, an active service member needs to be preparing to get out of the military with a proposed service-connected disability, have a memo rating of 20% or more, and is within their 180 days of being discharged from the military. Veterans must have a honorable discharge and a service-connected disability rating of at least 10% or more, or a memo rating of 20%. VR&E, Veteran Readiness and Employment, is not an educational program. It is a employment readiness program. The goal is to assist service members and veterans to obtain and maintain suitable employment that does not aggravate their service-connected disabilities. We want to ensure that they're having the services needed to transition from military to civilian life at work, through ensuring that they are put in a suitable employment situation. When they are attending school, that they are receiving all necessary accommodations to ensure their academic success, and ensuring that they are transitioning into their home life within their community. And if they are a veteran that has issues because of their service connected disabilities, making sure that we're maximizing their independence in their daily living. We utilize 5 tracks to provide services to veterans. They include reemployment, rapid access to employment, self-employment, employment through long-term services, and independent living services. Most people know about post 9/11 chapter 33, but just to give you a little bit, this gives you a comparison of the 2 educational chapters. VR&E, Veteran Readiness and Employment Services, is the only educational service that works solely with veterans with a service-connected disability. We are a 48-month education and employment program. We have, in addition to assisting you with going to school, we also have an employment coordinator that ensures the employment search and ensuring that a person is making the transition into the civilian employment situation. We provide education to include tuition and fees paid at 100%. That goes directly to the school. In addition to paying for tuition and fees, we also pay for all books and supplies required for the agreed upon vocational goal. And a veteran is also entitled to a monthly educational benefit. If a veteran is entitled to post 9/11, then we can pay them at the BAH rate for the zip code of the school to ensure their academic success. We're trying to make sure that we remove any barriers there may be that would prevent them from succeeding in their education as well as employment situation. The major difference between the 2 educational programs is that we are 48 months, they are 36 months. We have a counselor that works with you throughout the program, and they do not have counselor oversights.
Thank you very much.
Thank you very much for taking this moment to hear about our educational.
And we're going to pass it over to our colleague Scott at the Veterans Health Administration now to keep it going.
Great, thank you. So my name is Scott Dedayan. I'm with the VA New York, New Jersey Health Network, but specifically for today, talking about VA New Jersey healthcare. And we'll have the contact information, like Willie mentioned in the slides when they go out following the presentation. So for VA healthcare, we have 11 facilities. We cover the 14 northern counties in the state. The southwest component of New Jersey, Burlington County, down that western border is covered under Philadelphia, and southeast, the remaining counties are under Wilmington, Delaware. So sometimes it does get a little confusing. We're VA New Jersey healthcare, but we don't cover the entire state. But for purposes of everyone in the northern counties, VA New Jersey healthcare system is your local supporting VA medical facilities. So we have two VA medical centers, East Orange and Lyons. What's important to know about that is East Orange VA Medical Center is a full service hospital with an emergency room, and Lyons has most of the services available at East Orange, but the important piece is that there is no emergency room at Lyons. So if you are in an emergent type situation and able to say that you're a veteran and would like to go to a VA hospital, don't ask to go to Lyons, because the ambulance will get sent to the next local hospital once you arrive there. There is no emergency service at Lyons. After the medical centers, we have community-based outpatient clinics. Those are dispersed across nearly every county. There's a few counties that don't have clinics in them, but these are for completing your primary care appointments and lab work. Every clinic has the ability to do blood draws and collect samples, and they will send them to the lab at the medical centers for processing, and you and your doctor will get the results back. So it makes it so you can do that through your clinic rather than going to the medical center, to make it a little bit more accessible for veterans just doing their yearly or 6-month checkups. So for the general area of this district, I think Morristown and Patterson are closest. Some people may choose to go up to Newton. The biggest thing to know is that you're not obligated to use any specific site. It's whatever works best for you. If you don't mind driving an hour south to go to Tom's River, go for it. The travel will become kind of a question, like, why are you going so far? But it's perfectly within your rights to do that. So I personally am a patient at the Morristown Clinic, and they're fantastic. I have nothing but good things to say about them, even despite being an employee working here. Go ahead, Rob. So the biggest thing that is asked often is, how do I get VA healthcare? So we do have eligibility requirements. Not every person who served in the military is eligible for VA healthcare, but most are. The first piece that we go for is your active duty time served, not for training. So if you served post 1980, the specific date is September something. I believe it's September 15th. I always forget. That's why I didn't include it. But generally speaking, if you served post 1980, you need 2 years of consecutive active duty service, not for training. So AIT or basic training does not factor into that. Or if you are Reserve or National Guard, you were served on federal Title X orders in completion. So if it was an 11-month Title X deployment to Afghanistan in 2004, that would satisfy the service requirement under active duty because it was a federal activation. Prior to 1980, we're looking for 1 day active duty service, not for training. The difference is primarily due to the draft setting prior to that time, and the 4-year enlistment becoming the standard after 1980. If someone doesn't meet those service requirements, there are still ways that they can earn eligibility for VA healthcare, but generally that is the first thing that we're looking at to establish whether or not we can move forward with researching their eligibility. After checking the active duty service time, we look at any immediate eligibility groups. So if you received the Medal of Honor, or a prisoner of war, Purple Heart recipient, all of those immediately you're eligible for VA healthcare regardless of anything else. If you have a service-connected disability rating with VBA, like Rob was mentioning, that earns full utilization of VA healthcare under the virtue of you being service-connected. As percentages go up, there are different benefits. For example, at 50% and higher, copays are no longer owed. If you are 10% to 50%, you have full utilization, but you would still owe copays, except you don't pay a copay for an appointment related to your service-connected issue. At 100%, it opens up everything, plus our dental service. One thing with VHA, the only veterans who are entitled to dental care within VA are 100% service-connected veterans, or if you have a service connection to do with your mouth, jaw, teeth, that will open up eligibility for dental. Is one of the most sought after things. We get patients asking all the time, how do I get dental? And that's the pull the curtain back answer, 100% or service connected, something to do with your mouth, and then dental becomes available. Moving on from that, the new legislation from a few years ago, the PACT Act, opened up further categories of veterans who are eligible for healthcare due to the presumption of toxic exposure. So prior to the PACT Act, you really only saw Agent Orange exposed veterans with Vietnam service, or Camp Lejeune service to do with the contaminated water. PACT Act expanded some of the groups that constitute Vietnam service. It added the first Gulf War, Desert Storm and Desert Shield service due to Middle East and burning oil fields and what they call Gulf War syndrome. Unsure where this came from, but we're pretty sure it has to do with your service. And then for the post 9/11 deployments, all in the Middle East areas of operations, Iraq, Afghanistan, all of those different areas, including the for Navy service in the Gulf and Air Force support, countries, the second wave back support areas. Finally, after going through all of those things to verify you have enough service and whether or not you're in an immediate eligibility group, then we conduct an income assessment. So if you are not in any of those groups that establish immediate eligibility that would waive the income assessment, which is the first four there, the Medal of Honor, Prisoner of War, Purple Heart, or service connected, we have to conduct an income assessment. The number of what that income threshold would be varies by county all across the country. Every county in the United States has its own number. And the way that we figure that is using last year's tax information. You take the veteran's income. If they are married, you add the spouse's income, and then you subtract the veteran only medical expenses for the year. So generally speaking, this is a rough estimate for New Jersey. It's about $45,000 for the veteran alone and $65,000 for the veteran and spouse. So, for example, if you're a veteran not married and you have an yearly income of $70,000, but you spend $30,000 in medical costs, which can include insurance premiums, copays, medication, special diabetic shoes and socks, things like that, devices that you may need, all of that combined, you come up to 30,000 and you end up at 40 under the threshold, then you would be found to be within the income threshold. Why that exists is a complicated discussion. It has to do with mobilizing the reserves and National Guard in the early years of post 9/11 conflict in Iraq and Afghanistan, with a general feeling that if you have above that threshold, you can afford to purchase your own insurance or utilize Medicaid, what might be available through your job. However, what we find is that many older veterans who are on fixed incomes or Medicare won't cover everything that they need are able to fit within that income threshold. In an event where someone does not, then we open a conversation about, is there anything you might be able to file a claim for, and connect you with VBA and VSOs to file a claim. If you get service connection, even at just 10%, it will override the income assessment, and then we can extend healthcare to you. So this quote at the bottom here, VA healthcare is not insurance. I say this when I give in-person presentations over and over and over. It is not insurance. It's not insurance. Is it insurance? No, it's not insurance. Even though you get an ID card and it looks very much like an insurance card, VA healthcare is not insurance. No private entity is able to bill the VA off of that VA health identification card. The better way to think of it, as I've written out here, is if you're enrolled with VA for healthcare, you're a member of a national healthcare system and you have access to all of our facilities. There are situations where we can send veterans out to get care in the community, but that does not use your VA ID card as the means of payment. It's all handled internally between VA and the provider. So some people, just out of familiarity or what you're used to, they'll say, I have VA insurance. No, you don't. You're enrolled with VA for healthcare, and that's just to make sure you don't accidentally end up in a situation where you expect that a private healthcare provider can bill VA for your care and find out that they can't. So if you didn't know that, I hope that clarifies. If you did know already, good. It's not insurance. VA is not insurance. VA is not insurance. Unless you have life insurance through VBA, but that's different. Go ahead, Rob. Oh, that was the last slide. So the best thing to know for VA healthcare, and I've said this to people in the past, if you applied and were denied years ago, we always suggest applying again. Legislation comes through frequently that changes the eligibility requirements. The income threshold changes year to year with cost of living adjustments and figures. So a denial in the past does not mean certainly that you would be denied again if you were to apply again. And from my position, when I work with somebody to help them do the enrollment process and they do come back with a denial, it opens up a conversation for follow-up. Okay, what else might we be able to do to find a way to establish that eligibility for you? So it's very infrequent that I end up in a situation where I have to say, sorry, there's almost nothing possible. There's almost always a pathway. So we have the Q&A available for questions, and I'm happy to answer any that any may have.
All right. Thank you so much, Robert, Shania, and Scott. We do have some questions and some pre-submitted ones. So I'll start going through those. One reminder, anyone that is listening, if you have a question that you'd like answered, please use the Q&A feature in Zoom. So type it in the Q&A feature. We're going to get to as many of these as we can. Let's start with Scott, for VA healthcare, how do you enroll in the system? Like, how do you get started here, and what do you need to enroll?
So the enrollment form is a VA form 1010 VA-EZ. That is the application for VA health enrollment. You can go to any VA facility, so either the medical centers, East Orange or Lions, or to a local clinic, and tell them that you're interested in enrolling. Usually, if they are not able to give you space to complete the form on site, they'll give you the form and say bring it back completed. When I'm working with somebody, I can send the form via email for you to complete. So sometimes we're able to work in ways to shorten the process, but what is required is the VA form 1010 EZ and a copy of your DD 214 discharge. So those two documents are sent to our enrollment people. They verify everything on the application being completed in full, and will compare to the DD 214 to verify any immediate eligibility groups. And then that is either processed through and you're enrolled, or it will be rejected for some reason. Most of the time, the rejections are either income or insufficient service time. And then that is, like I said earlier, that opens the conversation of where can we go from here, potentially. And Rob, thank you. He just posted the link to the 1010 EZ form. On the VA website, it's a fillable form. So you can fill it out online and print it and bring in that printed form. So if you're comfortable on a computer and are have access to a printer, as not everyone does, you can do it on your own and just bring it in completed. You don't need an appointment or anything like that to bring in an enrollment application.
Great. And you can start it by phone too, right? Like you can call that VHA number.
There is a on the VA website. So you can also, instead of doing it locally, you can enroll via the VA website directly, or call a number. But that process takes more time because it goes directly to the processing center in Georgia, I believe. So we've seen that it can take longer to get an enrollment completed if you do it via the VA website, the general process. If you do it locally with us, we can get it completed faster.
Great. That's good to know. Thank you so much. Next for Robert, I guess the question is, what have you been seeing under the PACT Act with claims that are coming in? And then we had a specific question about, is there a list of specific ships that qualify as blue or brown water under the PACT Act?
Great. So since 2021, really, the PACT Act it's a law that expanded access, right, to eligibility, whether it was location or presumptive conditions. And there were a record number of new claims sent to the VA. So that hopefully answers the first part of your question, that the PACT Act, being that it expanded access to VA benefits, we have more claims than ever. As for any specific ships associated with presumptive conditions, be it you'd mentioned blue or brown water conditions. The PACT Act is not specifically associated, my understanding, with Navy ships in this regard, but rather the toxic exposures during their military service, such as like Agent Orange on brown water Navy vessels, right, in Vietnam, or asbestos on many older Navy ships. So it's more so the era itself in that regard. But if you go to va.gov, you would see a list of presumptive conditions, exposures, like certain locations that are more associated with those types of claims. So I would recommend going to va.gov and looking at the list of presumptive conditions to see exactly, based on your condition and based on where you served and the era that you served. That's the best way I could answer that, because it really is a law that vastly expanded the opportunity and the access to benefit eligibility. So I would refer you to va.gov for sure. Or again, you can call the 1-800 number and speak to a subject matter expert or even a VSO in many cases if they have a better understanding of your actual injury, right? You sat down with them, you've assigned them to be your VSO. They then could look at your history, your injury that you incurred during active duty service, and they can say, hey, you would apply for this, you should apply for that. Otherwise, you can apply for really anything, and then the VA will then process with examiners and raters and all that. So,
Rob, is it accurate that the prior to PACT Act with Agent Orange, you had the Blue Water Navy. There was a list of ships that were presumed or known to have Agent Orange. Is that not necessarily used anymore? It's more of a claim by claim
yeah,
basis after PACT Act.
my understanding is it's claim by claim after PACT, but I could be wrong. I would go to va.gov and look for like specifically because they're it really depends and they get deep into it too. So I don't
Yeah.
feel comfortable giving a direct answer, especially because I'm not a rater, I'm not a processor, right? So but again, my understanding is that that changed with PACT. So
I remember that so just as general statement for everybody, as to when I make the point, it'll make sense. The ship list developed as a result of claims being submitted with proof and
mhm.
statements, and so that originally there was no ship list until VA was presented with evidence that there was Agent Orange on the ship, and then it started to grow as more claims came in. So the general advice that we give to people and the VSOs as well will give is if you believe it's there, file the claim. The very worst thing that happens is it gets denied, and then there's a means of appealing it and providing more information or trying to continue. It may be stressful for you as the veteran, but there is consistent avenues within VA to keep it going and not give up, so to speak. In a lot of cases, like I was mentioning with healthcare enrollment, a no from VA is not always a no, period, end of story. There's nothing you can do. There is almost always a means of following up on it, disagreeing, having someone else look at it like a higher level review with VBA. So if you feel confident about it, if you've encountered denials in the past, it's not a game over, quote unquote. There's almost always a route of following up or continuing with it, especially when legislation changes. But as Robert mentioned earlier, that's why we recommend using an accredited VSO, because they are educated on all of this stuff to be as helpful to you, the veteran, as possible.
Thank you guys so much.
Yeah,
Before
thank you,
we get
Scott,
to,
too.
yeah, before we get to the next question, one thing is I'm gonna second everything everyone is saying about the VSOs. There are excellent county and state VSOs in every county here in New Jersey, and they are fantastic. What I will say is, if you're a veteran, or even if you're a family member of a veteran trying to help someone, what we found is you're only going to do this once or twice in your life. They do this multiple times a day. Like they can really help guide you through this process, help you respond to paperwork, help keep it organized. We really, really recommend. So it's going to go out with these slides, but in any of the counties, and feel free to reach out to our office. I'm happy to connect you as well. The other thing I will point out too is for a lot of these benefits, the key to getting them is the military separation paper, the DD Form 214 or equivalent. If you don't have that for the veteran, please feel free, please contact our office. That is something that we can help you with. We can help you put in the request to the National Archives to get that as quickly as we can. All right. Next question. A question from Mike here. I'm retired military with health benefits through Medicare and TRICARE for life. Is there any health benefit available through VA that's not available through Medicare and TRICARE for life? So I guess the question is, I'm kind of hearing here is if I'm retired military, got TRICARE and Medicare, is it should I also enroll in VA? Is that worth it to me?
It's a common question. When that happens, it becomes a matter of what works for you. So there's sometimes issues of does a provider accept TRICARE for life? Do they work with Medicaid? Does the service that you need or the procedure that you need going to accept the options that you have? VA gives you another option. If you are also service connected for any illness or condition, then there's chances that VA care would be free, where the other TRICARE or Medicare you may have copays that you owe. There are some veterans who use VA as a backup. They'll come to a primary care appointment once a year just to stay active in our system, but they get everything from outside. They have a personal doctor they'd like to keep seeing. Other people use VA exclusively and don't have anything else except maybe a Medicare Part B, and everything in between. I can tell you, me personally, I have health insurance via the plan that covers my family. I'm covered with that as well, but I use VA as my healthcare of choice. What will happen is when you carry multiple resources, VA can bill your insurance as a provider. It shouldn't affect you or money owed by you at all, but you would see on your explanation of benefits that VA billed for services provided, and the very, it's going to sound dismissive. I don't mean it that way. The very simple reason is we do that because we can. It's a way of supplementing funding to the medical center to allow us to do some above and beyond things outside of the budgeted operations costs. So like I said, it shouldn't impact what you have to pay directly, but you would see that VA billed your insurance, except for Medicare, because the government can't bill itself. It's like you're taking out of one pot to fill the other. It really doesn't work that way. So VA won't bill Medicare, but we would bill TRICARE if you're carrying that. So not to be non-committal, but it really is your choice what will work for you. The specific question, is there anything VA offers that wouldn't be under TRICARE or Medicare? Some of the benefits of VA healthcare that I didn't get into earlier, you, as an enrolled user, it doesn't matter service connected or not, you're entitled to a yearly vision exam, and you get a pair of eyeglasses for free if you need glasses as part of that benefit every year. So you get a new pair of glasses yearly if needed. If you take an audio exam and it's found that you need hearing aids, we'll provide you for free a pair of hearing aids. The newer ones are like Bluetooth rechargeable, higher tech. If it was the older style that need replaceable batteries, we would give you the batteries as well. And any type of prosthetic device, everything from replacement limbs, if you had an amputation, all the way to canes, walkers, diabetic socks and shoes, braces for joints, CPAP machines, essentially anything you can think of comes via our prosthetics department, and those are issued, if the doctor prescribes it, it's issued to you free of charge. So in a standard insurance-based model, you would have to buy those things on your own, or it would be charged as part of your service, whether or not there's a copay, it gets into that. With VA, if we say you need this and we provide it via prosthetics, it's free. So that again is a situation where some people might pick and choose what they use VA for. Where it does get complicated and potentially could be a headache for you is if you want to use an outside doctor and have VA fill prescriptions from them, that's not as easy to do. Or an outside doctor says you need this specific type of brace. You'd have to get the records shared to us from that doctor, have our doctors concur. It just becomes a little bit more complicated. It's not impossible, but you'd have to go through some extra steps to make it happen. So again, like I said, it's really a case-by-case basis, whatever you feel works for you. My personal opinion, based on my own experience, is give VA a try and see how you feel using our facilities and the things that you get as a result, and make your decision from there.
Great. Thank you, Scott. Next question I have here is for Robert. It's from Ron. He has a scenario, right? So he said, I applied for a rating 2 years ago and I was denied. And then I recently learned more about my exposure to toxins. Can I reopen my case or do I have to reapply? If I'm awarded a rating, will it go back to the original date or will it go to a new one?
So it all depends on the actual claim. Always, the one thing we would recommend is working with the VSO, of course, right? I know we can't stress that enough. But when it comes to appeals, the basic point that we always make is you have 1 year, right? If a claim is completed, and you have new and relevant evidence, right? That wasn't utilized on the initial decision of that claim. You're given a rating decision letter, right, with a narrative, and at the bottom of that letter, there's a whole decision review option section with 3 different appeals. If there's new and relevant evidence, you would utilize what's called a supplemental claim, right? And then you would submit that supplemental. It's an 0995 with your VSO or by yourself, and that information right to VA, and then VA would then backdate and grant, if favorably, right, that claim back to the original. If it's beyond a year, at that point, we normally recommend submitting a new claim with a VSO or yourself, right? However, there are cases where board appeals, right, have gone back and granted, be it through a remand or a situation where a claim was wrongfully decided, right? So in this case, again, depends on the specific contention, and I don't want the guest to reveal any kind of contention. I would rather that guest speak to a VSO or call VA directly, the benefits line, the 1-800-827-1000 line. But in most cases, believe it or not, our new claims are actually going faster than ever being completed. Right now, I think we have an average of 160 days now for a claim to be completed from start to finish, as long as it's fully developed, meaning that we have like the actual personnel records from the start. But that's a whole other topic to get into. But yeah, hopefully that answers most of your question. Generally speaking, there is a year time frame to appeal any kind of claim you have, whether it be through a supplemental appeal or if you want a higher level review of that same decision made, right, by a different team, or a DROC, a Decision Review Operations Center, or if you want to appeal that to the Board of Veterans Appeals. However, again, board appeals can go well beyond because they get docketed for years and they take much longer given the capacity of the Board of Veterans Appeals itself. So hopefully that answers some of your question in that regard.
Great. Thank you so much. Scott, I have a question here. We also get this, I feel like a fair amount in the office, right? People calling on either veterans or they're calling on behalf of, a parent or a friend. What are the VA's options for in-home care and nursing home care? Like, what are the options? Who's eligible for that? How do you access it?
So we do have a couple of in-home options. There's a in-home primary care department for mobility problems, but there's a screening type situation where we have to evaluate what constitutes the veteran as being homebound. Sometimes if it's specifically a transportation issue, we may be able to solve that. We can offer transportation support for veterans that need that. If it's a situation where mobility, they are in a hospital bed and they can't get out of bed, then either we can provide the in-home care, or it would go through our community care department to have visiting care coming into the home, paid for by VA, but provided by a community organization. Nursing home, we have in Lyons, it's called the CLC, Community Living Center. The requirement for that is veteran has to be 70% service connected or higher. And there is a wait list to get in, which is freed up when we have a resident pass away, essentially. I can't say for sure how long that wait list is, but the general block on that, you could say, is the 70% or higher service connection. Outside of VA, there are also 3 state homes operated by the New Jersey Department of Military and Veteran Affairs. The closest up here is in Paramus. They're not free, but they are, generally speaking, more affordable than private nursing home care. And it's a situation where, again, you'd want to talk to a VSO about claiming for, there's a benefit available through the regional office called aid and attendance that comes in when there are medical needs above and beyond what standard healthcare can support. So if you need visiting nurse or nursing home care, things like that, it's a benefit that can defray some of the costs that you would incur paying for that care. So it's always worth looking into that. But Willie, that's probably something you can include in what goes out to everyone, is information for the state homes. I believe off the top of my head, I can't think of the singular person, but the state VSOs all have a pathway to connect somebody who's interested in information about the state nursing homes, the
I
state
would agree
veterans
with
homes, I
I
should
agree
say.
with that. The application is it's a little bit of a process, but all the VSOs, I think even like the county ones, they're experienced in helping people through that application. And I believe the homes themselves have enrollment coordinators that can answer questions from either the veteran or a family member. They're used to that.
Yes, that's correct.
But if you
I just
are
don't know. I used to know who it was. I couldn't tell you now.
Yeah, I think like I said, I know they have enrollment. Like if you have a question too, just reach out to our office. We'll connect you. I'm happy to do that. And then if you're potentially interested, I think you can also go take a tour of them. But great. Thank you so much for that. And then Scott, did you say like if you're interested in the in-home care, how do you access it? Like what's step one there?
So if you're a veteran who's already using VA for healthcare, you have primary care doctor established at one of our locations already, it's a conversation to have with them. If you are a new patient enrolling, there's a location on the enrollment that asks where would you like to receive your primary care, where you can put either one of the medical centers or one of the community clinics, and that's for our scheduling department to have them contact you. You could put in that block homebound or in-home care requested, and that'll trigger to our enrollment folks once they process the enrollment and get it over to scheduling that it needs to go to the home care component to have that conversation. So in-home primary care, when we provide it, is a VA scheduling. It's handled all internally. The situation where it goes out to be a community care supplied service gets into the community care rules as defined by the Mission Act back in 2018, and there's all different criteria that go into that. If you think about community care as the old model of an HMO insurance situation, the primary care doctor is the pathway to getting the referral. So they need to concur on the need for community care, which gets kind of sticky if you're a new patient and you don't have a primary care doctor yet. That's why I say put it on the application form that there's this limitation to being able to come into a external location regularly. So knowing that when we get the application can help us to get you in touch with the right people for scheduling. So we don't just say, yeah, come on into East Orange. It's like, no, I can't. Right. There's also within the every VA healthcare system or facility has what are called patient advocates, and they are the generally speaking, they're the complaints department, but they're also I need help and I'm not sure who to talk to. You can contact the patient advocate. Their information is available on the VA New Jersey sub page of the VA's website, and just tell them I'm looking to enroll, or I submitted an enrollment, but I'm homebound for these reasons. I'm not sure what to do. They can help route it to the appropriate place. And also, Willie's office will submit those requests on behalf of veterans. It goes via the same team, but it gets routed to, can you get this veteran connected appropriately for in-home care? It just makes it so you're not trying to navigate this on yourself. If Willie's team can help with, which they help with everything pretty much, you utilize that as a resource, as a constituent. That's why it's there.
Yep, absolutely. Like I said, if you're ever stuck, right, like just feel free to pick up the phone. There's no stupid questions, right? We're always, if we don't have the answer, we will get you closer to someone who has it, and we all work together here, so we're all on the same team. All right, well, I want to be respectful of everyone's time, so let me give this over to any concluding remarks. Let me start with Robert and Shania. Do you have anything you'd like to conclude with?
Okay, yeah, no, I'll go first. Just thank you, Willie. Thank you to your office for hosting this event for us today. To kind of just showcase what we have here at the VA, the resources that we can provide. Sometimes it gets difficult, obviously, even for VA employees. Like there's a lot of information, and it's hard. I can't even imagine how hard it is when you're trying to submit a claim and you really just don't know what to do. So again, I can't stress enough, utilize a VSO, your local county or the national VSOs, or the state VSOs for assistance, or give us a call directly. Again, each administration, the numbers are on this screen, or go to va.gov, and we're going to hand out our information from these slides today to Willie to distribute to everyone who attended as well, which includes our Newark Regional Office number. So any questions on benefits that you need further answered, and you need some assistance, we'll be more than happy to set you up with someone that can definitely get that answered for you. So again, thank you for having us, Willie. And I'll pass it over to Shania too for any other remarks from the benefit side.
Again, you can always reach out to va.gov, go into the education section, and then you can pull up VRNE. Our main number, the regional office, 973-297-3216, and then the VRNE direct number is 973-297-3200.
And for myself with VHA, I didn't include it on the slide. I'm a veteran as well. I served in the U.S. Navy, and I am a recipient of all these benefits. I have service connection. I utilized VRNE for my education and job placement. And when I first got out of the Navy back in 2006, early 2007, I didn't know anything about VA benefits other than I had some availability of education benefit available to me, and there was something called service connection that I needed to look into. It wasn't until 10 years after that, when I started working with my first position with VA, that all of this information started coming into my view, and I realized benefits that I had not been using, as well as things that I either had misconceptions about or didn't fully understand. So My goal in my current position and all the positions I've had with VA is to try and prevent that from happening with other veterans that I meet. I didn't have a resource for a long time until I started working here. So when I'm able to meet new people and get information out, I become that resource that I didn't have. So all this is tremendous information. Utilize what's available to you. Like we said earlier, the majority of people within the VA are here to repay and honor your service in the military and help you access benefits that you earned. That's the most important component. These are benefits earned via service. Sometimes it feels like you have to fight for them. Sometimes that's accurate, but for the most part, it's just a matter of knowing how to get the process going, and that's what we're all here for.
Great. Thank you so much. So let me pull up our closing slide here. Thanks so much to all our panelists for joining us today. I mean, I know you guys are busy, and I really appreciate you taking the time to share this information with our constituents today. Thanks to everyone who's listening. If we didn't get to your question, please feel free to contact us at our Livingston office. The number should be up on that slide, but 973-526-5668. Just give us a call and we'll get back to you as soon as we can. There are a lot of VA benefits. There's some that maybe we weren't able to cover today. Please reach out to us. You can reach out to either the regional office or the healthcare system, or reach out to a VSO. And like I said, I'm happy to connect you with a VSO. They're great resources. As I mentioned at the top, this is a part of our ongoing webinar series. So our next webinar is this coming Tuesday. We're going to cover Medicare enrollment. So if you are nearing Medicare age, or if you have a family member that is, this is going to be a great opportunity to learn what to expect and to get your questions answered. Information is going to be going out soon on how to join. Check our website and email. So thank you again, everyone. And until next time, best wishes.